It's now my pleasure to introduce you all to Paul Francis Jr. Paul is the Vice President of Indo-Waipanashi, the Indigenous Health Partnership and Wellness Division of St. Joseph's Care Group in Thunder Bay, Ontario. Paul is a graduate of the Master of Social Work Indigenous Field of Study program at Wilfrid Laurier University. Paul is Odawa, Anishinaabe, and mixed European ancestry, and a member of the Wikiramikong unceded territory on Manitoulin Island. He's a member of the Bear Clan. Paul is committed to his Anishinaabe spiritual practices and enjoys attending and helping with traditional ceremonies. He believes in the power of integrating Indigenous healing practices within the mainstream healthcare system for the benefit of all. In this session, Paul and I will have a conversation about the program he helped to develop and currently assists in running, and discuss the role that social workers and social service workers can play in advancing truth and reconciliation in their communities. I've actually had the pleasure of visiting Paul at his hospital, so it's really great to have you here today. And I just wanted you to sort of set the scene a bit for us, Paul, and maybe talk to us about your role as Vice President of Indo-Waipanashi, the Indigenous Health, Wellness, and Partnership at St. Joseph's Care Group, and maybe also talk to us about the journey of how you came to this role and the process by which you came to it.
Okay. Say miigwech for the sema, the tobacco, and ani bojo, shkade manatu banas indigo makwa nindoram, hokomakong indojaba, Thunder Bay and Nindao. Yeah, it's going on, it'll be 7 years this September that I've been at St. Joseph's Care Group. And 2 years as vice president. So I think the role is significant. There is not a representation of Indigenous people in healthcare or social services. So to have a seat at the table at the executive level is really significant. So I'll start with that position. So that it is really important, and I think that has been maybe even just a level up on our program and what we're doing within St. Joseph's Care Group. The position really is about building relationships and partnerships with I'll say Indigenous people in our area, Anishinaabe people, and really trying to regain trust, and we have a wide array of programs from addictions, mental health, to a rehab hospital to long-term care, and it's really about creating safe, culturally appropriate programs. And so I would say that's the simplest form of the role, and then. Yeah, to go back on the journey is it's interesting. I went for lunch last week with one of the VPs that hired me, and she's retired now and living in BC. But when I first started, I was in a manager role. We had one Indigenous position, and I had other accountabilities, spiritual care, ethics, volunteer services, smaller portfolio like that. But the focus really was on the Indigenous piece. And we had a long-standing committee that was kind of developed through the Truth and Reconciliation. And it was primarily all non-Indigenous people. And so that was the first thing to be able to say to her was, this is a very kind of colonial way. We kind of have to. So that kind of started some of the conversation, and then, to her credit, she said, "Okay, if you had 2 years, if you could write down a plan, what would you do?" And so I would say that was kind of the birth of the Walking with Humility. Doing my own research of the organization, not typical where you would go and engage the community. A lot of times you start that way, but really didn't know where this was going to go. And so just using a lot of existing reports and kind of laid out this walking with humility, developing relationships with Indigenous people. And it took about 7 months, and it was approved. And it, from there, they created the director position. The second position I had, director of Indigenous relations, and then we started with a traditional healing coordinator, and we'll get into a little bit more of that later. But that was kind of the foundation that I really wanted to start with, was our culture, our way of life, and really start from that foundation. And so that was the initial position, and then it just grew. I would say there still is a lot of really challenging, I don't know if we'll call them roadblocks or difficult periods to go through. But I feel we're at a really good place. We have a team of over 33, 34 staff. And so, yeah, we're kind of have the solid foundation that we need to move things forward.
I think also we think about, you said, took 7 months, tiny, envision the process for it to really be adapted. And for those of us that are joining here today and also listening, would you say, I'm asking a question that I know that's not the answer, but like, it wasn't a straight line, right, of success?
No, and it didn't take, like, I think there was months of me writing it, and then drafts, and there was even I would say some sticking points around some of the history. And so we are a Catholic sponsored organization. There is a legacy across, not even Canada, I would say, the world of Catholic healthcare, and primarily in Canada, it was different sisters congregation. Ours, the Sisters of St. Joseph of Sault Ste. Marie. And they did create this great legacy, but one of the early staff members, and she's now a member of our Elders Council and elder in residence with us, shared with me, another part of the history, and they also administered the residential school in Thunder Bay. And so that was a really difficult evolution to where we are, and even being able to share that truth. And now we have a commitment statement from our board of directors, and there's been a lot of meeting with the sisters. The local bishop has always been sits on our board, and so there's been a lot of engagement with the Catholic Church, and so that's been a big part of this work as well.
Yeah, and I think that's like, when you think about what success could look like, to coexist in that, and to be successful in that space, I think it says a lot about the team that you've developed.
Yeah, I would say it says a lot about our people. We are in national, or I don't know if it's national, but Indigenous History Month. And there's still a real lack of knowledge of the history, and to get to the truth of the history. But the TRC, it was cultural genocide of our people. We don't have the exact numbers, but a significant loss of our population. I wouldn't say a loss, but a real damaging part to language. We were talking about language, and language is so important. I'll say trample on our rights. There was lots going on here yesterday with political action. Again, our rights aren't respected. Our treaty rights, people don't have it under. Canadians don't have the greatest understanding of treaties. And so I think that's a really important part of this, is really trying to get to that history, the truth telling part. There's such a long history Indian hospitals, like segregated healthcare, um, you know, purposeful smallpox. Like these things weren't by accident, and so it's really hard to build trusting relationship with the communities. So I think that's a really important role our team plays. For sure.
Thank you. And I think for social workers and social service workers attending today's session, like when we think about walking with humility, the strategy itself, can you walk us through the strategy?
Yeah, so I share a little bit about it. And now I talk about it. It is, you can call it the strategic plan or strategy, but it's more than that. So it's a spiritual living document. And so I won't go into too much detail, but it was done in ceremony, and it's renewed through ceremony, with support from elders. And the report is a long-term plan, so it's following the four sacred cardinal directions, which are really sacred to our people and to most Indigenous people, and those are the four we know as the four directions: the east, the south, and we're currently in the west, 2024 to 2028. And so it's a very spiritual journey, even just how it's kind of happening with those journeys, the things that we're encountering, the growth, the lessons that we're learning. And I think doing it through that way is vital. And we always, we've always had these kind of concepts, 7 generations looking ahead. But we don't just look ahead, like we look to the past. We look at our current landscape, and then we try to think ahead. And so that's what that's what the strategy really trying to is incorporate, past, present, and future, and, really focusing on what we can do over the next few years.
And talk to us a little bit about what that looks like in terms of the community engagement. So, how is the Indigenous Traditional Healing Services, how have they created space within St. Joseph's Care Group for individuals? Have you seen sort of the engagement pick up as the years have gone by? You've been there 8 years. You've seen sort of the transition and evolution of this, and maybe some like truly what you see as a positive reinforcement of the work that you're doing when you're walking the halls through the hospital.
Yeah, I would say like the part of the strategy is the humility, and I think that was, part of the question was, what does it take for social workers and other people. And I think sometimes for professionals, it's hard not to be the expert. We go to school, we study for long periods of time, and we really specialize things. But I think that approach doesn't work with Indigenous people, with First Nation peoples. We are, the expert of our own care. We have a different world view on how things look and how we see the world, and that doesn't always align with Western or professional practices or standards of care. And so, I think people have to put themselves in that uncomfortable as a professional to be a learner as well, and look at it as walking with somebody, and not the expert to what they need. So that's vital, and I can say where that has started in our organization is our leadership team. And I say we're slowly kind of, there's a lot of work to roll that out, but I think having myself at the leadership team, we're able to talk about these things on the weekly, on the daily thing. So there's a lot of learning by our team, and they really do, from the CEO to all of our other VPs, really do take that approach, and have enabled and supported me to do what I need to do. And so, yeah, I think, I always tell people that haven't been in our organization like for a while, I feel like we're transforming the organization. It looks very, very different from someone that might have worked there 8 to 10 years ago. And I think that's a good thing. We're allowing diversity. We've really worked hard on visual um, pieces into the hospital, creating not just clinical care, but physical care, making people feel welcome when they come in. And so uh, some of the things I can think about in the hospital, we have the treaty acknowledgement of 1850, Robinson Superior Treaty. So we have the original treaty up in there, and then an education piece to it. And it's a pretty large, in a high traffic area. So that has gotten a lot of good attention from clients, Indigenous clients that may see it, from other people stopping and reading and looking at it. Also, our commitment statements, which can be found in the updated Walking with Humility, we have that strategically throughout the organization as well. We're a multi-site organization, so we're trying to replicate these things. And but yeah, I'd say the physical piece is vitally important as well.
And how big is the team now?
Our team,
Mm-hmm.
I think about 33, 34. Yeah. So we have myself, vice president. We have a director of Indigenous Health, a regional director, which is a new position, in collaboration with the region, really trying to focus on it and prioritize Indigenous issues. And then we have 4 managers: a clinical manager, a traditional healing manager, manager of Indigenous cultural safety, and then a new project that we're trying to get off the ground is land-based healing.
That's for all 3 sites.
Yeah, everyone's kind of, I think we're like 8 sites, St. Joe's. Yeah. So most of our staff are kind of housed out of the hospital, and a lot of the frontline kind of are moving around and very active to supporting all the programs in place.
That's great.
Yeah.
As you know, our registrants work with clients and communities across the province, and we do have registrants who self-identify Indigenous and work with Indigenous communities. But then we also have registrants that are non-Indigenous backgrounds working in Indigenous communities. So when we think about these registrants and the work that you've done, the non-Indigenous registrants working with their local Indigenous communities, what kind of guidelines or advice can you give them in terms of things that they can sort of set their mind to and assist them in engaging with the communities and ensuring that they engage with them back so that they can provide care? So what would be helpful?
One, I would say we're very diverse. So, don't, what you might work with one community and even within the same tribal group, we're very different. So I would say, like, try not to have those assumptions or preconceived notions. Yeah, I think if you're working right in community, like, it's really trying to understand how our communities work, and they're very different. I would say from mainstream communities. We do have chief and council, which is a colonial system, but it is a system that we have, and we're working through that. So, I think being respectful of leadership, being respectful of elders, but really trying to, I think what would really takes commitment to is the education piece, and being open to understanding that history. You know, um, working with people, asking them, what, does this work? Like, there's a lot of things you'll read about, like, people don't like eye contact.
Right.
Well, maybe ask them.
Yeah.
Maybe some do, maybe some don't. And just being open. I would say the one strength of our community is our humor. Our people have a lot of humor, and has taken us a lot away. And we always kind of say, if they're teasing you or joking you, joking with you, it's a good thing, and so I would say kind of drop, kind of a lot of the professional things that you learn, and not saying not to be professional, but just, you know, be more on that human, we call it lots human-centered approach, the heart-centered approach. And I think sometimes our professionals associations can be so focused on professionalism, we forget that we're working with human beings. And when you look at the history and the treatment of our people, if you're not going to be human, you're not going to get anywhere with your practice and trying to support people. And so I think it's really important to kind of start from that lens.
I think that's great advice. And I think even as a regulator, with the standards that we have, we often have individuals sort of looking at the standards and assuming that they have to be perfect or incredibly formal to provide care and be available, and that vulnerability, that ability to connect with your client, to meet them at their level, to be open to what they're providing in terms of their treatment, their past, their experiences, when you're sort of walking through, right, like that's really. And I think maybe for a registrant, don't feel safe doing that because they feel like, oh, wait, am I breaking a rule? Shouldn't I be setting this very structurally in front of you? And that doesn't always work. And I think having that dialogue.
I can give you a perfect example.
Yes, please.
So this was outside my work, just more consulting type of work and working with the community in our area. And we were doing just a bit of the history, and I had an elder with me, and he's kind of sharing his journey. And after the session, like, I was being paid to be there, and a older lady, I would say, I don't know, maybe not that old, but in her 50s, 60s, came up and said how, I don't even remember what exactly what it was, but that had really said something that had helped her. And so she wanted to give me a gift, and I don't even, it was a little bit of money. I don't remember. I was like, oh, I can't take that, and so later I was scolded by the elder on the drive home because it was insulting, and so, that's a protocol in our culture is when you give, you receive. And so, like, and I always tell people, I have a private practice too. I say, like, I get, it's not just me supporting you. Like, in my helping to people, in turn, I receive, and that's just a natural thing. And within reason, if someone wants to show that appreciation, you do more damage. And so that's where these policies and standards really impact our culture. The real kind of tangible thing that.
And I think when we think about the college wanting to be in the spaces to speak with the communities, to understand ways to work through the standards the way they're written, like, how could you accept in a way that allows you to then sort of protect yourself if it ever comes back to you. So those are the types of discussions we want to continue to have as we move through the communities, right? Because these are built, we don't want standards that are built in isolation. We understand that they're going to take a different pathway when they're in different spaces.
Right.
But with that in mind as well, and I know this is, we talked about some of these questions ahead of time, but Paul, you and I have spoken before. When you're thinking of a policy that you've changed, I know the smudging was one. Could you tell us that story? I know we didn't, it's not part of the questions here, but in terms of the hospital and it's,
yeah, sure.
Yeah, because I think that's a great, tangible success story.
And I have permission to share now too, because so this was early on, I think within a year of me being there. I was actually at home sick and get a call from the staff saying a family wants to smudge the client or patient is palliative, end of life, and there had been a lot of traffic through to support her, and I don't think our hospital had really kind of dealt with that, the magnitude, because there was a lot of people coming through, and so I couldn't convince on the phone, and so we do have a beautiful space, which you've seen, the Spiritual Gathering Lodge, around circular room. And so they were like, well, they can have the ceremony there. And so they had planned that ceremony, and the bed wouldn't fit through. And so all these things going through, end of life, trying to provide ceremony to just like an incredible leader in our community. It was really hurtful. And so after the whole process, and there's a lot of things that we did do well. I'm thankful for one of the managers. He's a director now in long-term care, and he really bend the rules to support the family. And so we had a working group after to kind of debrief, and that's where the birth of our smudging policy came in. Like, just because you have a space, it shouldn't be limited to that space. And so we do have rights, and we have the right to practice our culture and our ceremony, and organizations have to oblige, and they can actually be fined. And I don't think people know this, but I think there is good information on Ontario human rights. And so we developed this policy and procedure, and our team can support, so we can pretty much smudge anywhere in our locations. Sometimes we'll give a little bit of notice. Sometimes we'll, if there's a window, we can open a window. If it's a shared room, we'll work with the clerk, the ward clerk, and the family.
Throughout all the sites.
That's throughout all the sites, but it goes through our program, and so we do have a traditional healing team.
Yeah.
And so I think a lot of places don't have what we have. So, like, if someone does light up a huge, amount of sage, it's going to set the alarm off. So these are the things that we work through, and we tested all the sites and worked with our building services and things like that. But today, to this day, I think it's still probably there's so many barriers across these spaces that don't allow it. But that created a lot of change within our organization, and the late elder, her daughter is actually on our board of directors now, and I remember I've been telling her, but I never shared the story, but she says, no, go ahead and share it. And her mother was the late Josephine Mandamin. For people that don't know, just type in the water walker, and she walked the Great Lakes many times for something that we can't live without, which is water, and gave a big part of her life to do that for everybody, not just for Indigenous people. And so even in her, transitioning and moving on into the next afterlife, she had a great impact just even within our organization to help share policy. And I always share that policy with organizations and put those things in. So yeah, I think that's one example of the policies that's had a big impact.
Yeah, I mean that's a great example, and a lot of work to change sort of a way of doing things that was so deeply rooted in
fear.
Yeah.
There was a lot of fear. It was a lot of fear. It's like, we're going to set the alarm off.
Yeah.
And so it's sitting down, okay, well, let's test it out. Let's, light the smudge.
Right.
Like.
And has there been any alarms set off?
No, we never set it off. I should probably have the data on how many times we smudged with a client over the years and you may one time, and it's.
But it's a known risk. And certainly I'm sure it helps in terms of the community seeking care at the institution, knowing that there's an acceptance for the processes and the ways of being.
For sure. Yeah. Like, I think that for people that practice our ceremonies and culture, it's super important. I think that's why lots of people don't want to go into the institutions or the barriers that they do face with mainstream practice. These are the tangible things that really impact that
difference. Yeah.
difference. Yeah.
Well, with that in mind, when you think about our registrants listening to you today and the types of sort of advocacy and allyship that they can foster in their own spaces, is there any broad-based advice that you can give them in terms of how to create that change? Keeping in mind, even in your story, we appreciate there's been challenges, there's continuous challenges, but you've made a foundational difference over the years. So if you can impart some of your successes and wisdom to our listeners at home, that would be great.
Allyship is like a big, there's a lot of literature out there on being a good ally for, I think, any kind of marginalized population, and they're pretty good at good advice. I think what's been kind of the game changer for some of the really good allies that work with us and work with our team is really coming and sitting with us, whether it's sitting with us in ceremony and really trying to understand, not become us. Like, we're not saying become us, but come and like experience what we're doing, experience what we say. And in your intro, our elders, the ones that hold these ceremonies, and they always say that. And a lot of younger people don't like to hear this, but our ceremonies are for everybody. They're not exclusively for Anishinaabe people, or they're meant to help heal everybody, and they actually, the world kind of needs them right now. We're experiencing climate change, or experiencing all these things that are super related to the Indigenous knowledge that we have and have developed for over a long period of time. So we need more of that. So I would say, put your uncomfortableness away, and if you are invited to participate in a ceremony or to a feast or something where there's real hands-on learning, I would say, try and open not necessarily your head, open your heart to experiencing these things, and try not to get too much into your space. And I think when people have done that, they become really good allies. Yeah.
And is it fair to say, like, for individuals to actually look for the opportunities to find themselves in spaces where they can find the opportunities to participate without, because I expect that if everyone comes knocking on your door, it becomes a bit much, because you can't devote that much time. So there's that balance of ensuring that you're not taking up time when you're learning, but allowing yourself to be open to the learning if it comes your way.
Yeah, I think there's a lot. Like I said, our people are very giving people. And I always say sometimes we give too much, but a lot of our people are there to help, and we're spread out across Ontario, across Canada. There's a lot of organizations, people that are willing to support. But it's having that right attitude, having that respect. Putting yourself in a good position to do that. And
yeah. Thanks, Paul. So as we sort of see through our questions, when you're thinking about the future of your work and of Indo-Namabash, I'm so sorry, I practiced
Indo-Way Benassi.
Indo-Way Benassi. I practiced it so many times. This is why we were talking about language, because I was tripping over my words. Indo-Way Benassi team, and your future of what you think you can do and expand. Can you talk us through what that would look like? What are you most excited about?
I think where we started, and that's, I'll say, the traditional healing. And so, like, this is kind of a common phrase that's shared, traditional healing, and I think people think smudging, or they may think of like a drum. But when we're talking about traditional healing, we're talking about our whole system of care that we had prior to contact. And so that original presentation, or the original position when I was presenting to our chief of staff to get that position. And before the hospitals, before the social work profession, we had natural helpers, we had elders, we had spiritual people, we had sweat lodges, we had um, medicine people that were knowledgeable of all the plants and how they could help. And so that's what I'm talking about for traditional healing, land-based healing, so to be able to develop those things and create space. And I don't say integrate, because they're two separate things, and they can coexist. And that's the original relationship of treaties and original relationship that we sought to have with the newcomers. And I know it works. I use it in my life, and so that's what gets me excited. And for the people that come and embrace that into their life and that their understanding, and then to be able to bring it into to these organizations or to these hospitals, I think that's what's needed.
Right.
And so that we were just doing a session earlier this week, and with a little bit of visioning, and that's what we were. We had like the logo of the snake and that for the medical, and then the medicine wheel encompassing the holistic approach and how everything's interrelated, from the spiritual, mental, physical, and emotional being, and looking at that and trying to strive for balance. So I think that's what excites me, being able to incorporate that, and seeing our natural roles that we have in our community come to light. And so we do have an elders council, a 6-member elders council that guides all of this work as well. But we didn't get too much into, but I think that's they're starting to get recognized.
Talk about that a little bit.
Yeah, so I would say they've been part of individually the work, and we've had a shift. We've had some that have just had to step away for work or other things, and
the Elders Council is addition to the actual staff that you have.
Yeah, so we do provide them honorarium, but it's not a board of directors. It's very different, but it is a governing structure where they oversee. And so we meet 4 times throughout the year for full day meetings. We meet in circle, we meet in ceremony. We have an agenda, we have paper, we take notes. But they advise us, and I'm there. Our CEO is there.
And what types of items are they advising on? Like, what would you be meeting with them about?
Everything policy.
Right.
So we would bring the smudging policy is something we would have brought there. Names, like the traditional names that we have, we bring things like that there. Pretty much everything. Like we update and they input, and then sometimes if there's something new that we're developing, so one of the newest things that we're developing is the Heart Hub.
Right.
Maybe you'll know of the safe consumption site shift in policy, and so our team is supporting the lead in Thunder Bay Norwest Community Health Center with a cultural outreach team. So our elders were heavily involved to design that. So they're playing that role. They're not telling us what to do. They're not giving us. They're guiding us and steering us on the things that are important, the culture and mentorship, leadership development. We've recently added 2 youth to the council.
Well.
Yeah, and then we have a board member as well sit there. So we're trying to engage even with our board.
Great.
So for people to understand, okay, what does Indigenous governance look like? How does it's because it's not advisory. People, oh, that's an advice. No, this is much more than an advisory council. But yeah.
And that's been adapted and has been continuing for a number of years as well. The elder.
Yeah, I would say individually, I met with them kind of, and then I formalized maybe 2 to 3 years after, and so they also have their name received through ceremony, which is Ogichida Onaknagewin. And the loose translation to that is like elder's law.
Yeah.
So Gitchada is kind of like a leader, warrior, elder. And Onaknagewin is means so much. Like it's not like the Western concept of law.
Right.
I would say more natural law, but it really respects the elders and their lived experience, their wisdom that they've developed, and respecting their place to guide and support and mentor.
And as they're guiding, if they don't like a certain part of the policy when you're bringing it forward to the group, is it? And I'm drawing comparison to what a governance body would look like, right? So is it a vote? Do they just
Consensus?
express? It's consensus.
It's consensus building. And a prime example, early on, we were bringing, I can't remember, the allyship group we have an allyship group. They wanted to use the medicine wheel, and one elder wasn't comfortable.
Right.
And so we held off, and they didn't use it. So that's one example where, they are impacting things, but we try to build consensus, and we're not in a rush to move things. And we take the time to talk through things, and and to do that in a spiritual way too. So I think it's I don't want to speak for anyone, but our CEOs have been at this, and they're very respectful, and they engage, and it's significant part. It really is the foundation to the work and to the success. Because when we are having challenges, we do lean on them heavily. Like, it's not just those 4 times. Like,
right.
They're actively involved, supporting clients, supporting our staff, supporting myself. So they're very
in between, or as a group, or one-on-one.
It could be either.
Right.
Yeah, they're supporting us continually. They're very invested. It's hard because they support the whole community. Like, right. They're not connected. We do have the one position that is like salaried, and it is in there, but the other ones are
voluntary.
Yeah, like they're they do get an honorarium, but
yeah.
They serve the community,
right?
And this is community,
and I imagine helps build the trust between the organization and the community too.
100% for sure.
That's great. Thank you, Paul. As we sort of come to the end of today's session, do you have any final thoughts that you'd like to share with our registrants, and we can open it up for questions as well?
Yeah, I think it's always just to, what I hear from a lot of non-Indigenous people is they're scared to do the wrong thing, say the wrong thing, and I think we have to move past that. Because of the history, because of where we're at, it's uncomfortable. It's uncomfortable for us. Like, we don't like talking about these negative parts of history and the realities and the challenges our people face today. We're uncomfortable. So I think people have to get into that space to take a risk.
Yeah.
Ask some questions. Do something. It's supposed to be truth and reconciliation. It's a living thing. Truth and reconciliation isn't a point in time. It's really building off the treaties, and it was about building an ongoing relationship and renewing that relationship, just like you would with neighbors and families and friends. And so I think we can never forget we are the original people in this territory, in Turtle Island, North America, Canada, and the United States. And we can't forget that. Anywhere you should go, you should learn the history of the land and that place. And there's so much learning for people to do that. So I think we can't forget that.
Yeah. No, thank you for that. And I think maybe a takeaway for even registrants that are maybe going to a different space, a different part of the province, and they're treating individuals, a place to start maybe is just to start with understanding what is that land, who are the people, and then build out from there. Would that be fair?
Sure. Yeah.
to start that allyship, to start that conversation. Thank you, Paul. I'm going to look to Sarah for questions, and we'll get some questions from our audience for you.
Great. Thanks so much. So just looking at the chat, a lot of positive comments just about the discussions today. We do have a question noting, as someone who worked in hospitals, I often found that sometimes the culture does not allow time for deep reflection when making decisions. Wondering how you maintain the practice of reflection in a large hospital system. What are your thoughts on that?
Very timely. We actually just had a session yesterday, part of our new overall St. Joseph's Care Group strategic plan. We're developing a quality program. And so part of that is that we would embrace a two-eyed seeing approach. So essentially, creating space for that Indigenous point of view. And this was a big part of the discussion, the concept of time, beds, system flow, clients. And, it's really hard to do that. Even our team, like, we're spread so thin. And that's a lot of the feedback we get from our clients is you don't spend enough time with us. People need more of that. So these are like big system changes. And, like some of the things we're able to do within our team, like, we have a weekly circle at Friday for staff that can kind of share their week, share some of their challenges, some of their successes. So we're trying to incorporate that, and we're in the pilot stage for our quality program. So, I think I think that's what we're trying to figure out. How can we incorporate some of these practices where we understand, these are the reasons why we're creating probably burnout. Our nurses, our frontline people are overworked, dealing with, really complicated healthcare needs that our community needs, and they need the time to work through that. So I think it's a really complicated answer, but I think leaning on some of these simple things, and even incorporating, I would say, say policy, they have a policy of debriefing a situation, maybe incorporate an Indigenous piece, the sharing circle, because that approach uses medicine, uses an elder, it's done in a different way than just a normal kind of debrief. So I'd say something like that could help.
Thank you for that. There's someone who's asked, if an organization has their own team of traditional healers and Indigenous clients ask for them, would the organization send out their healers, or does it have to be from your hospital team directly?
Like ours is a referral base through our program, and so we have a process to bring on elders and community people that we use. But if someone else has a healer that they use, we will support them through it, like access to the space. Like I know we have done that, but primarily, people are more than welcome to use their own elders and healers, but we do have, a process to do that.
Thank you. There's also some conversations around the realities of colonial structures and systems, and colonial practices, and how, might we move into non-performative ways and really participate in reconciliation, and how we might be able to engage even at the college level in terms of decolonization and what that looks like with the reality of colonial structures.
Can you repeat?
Yeah, I think it's just sort of talking through the reality that we're working in colonial structures and systems, and how you can sort of find ways to decolonize.
Yeah, I think that's the language from like the university system, and I think it's recognizing the what the systems are, and that's what we're kind of working in. And um, I think there's a lot of things that need to happen in order to do that. There has to be a willingness. There has to be leadership on board. You have to have the right Indigenous leadership. You have to have people that are connected to culture, to community, that are grounded in their, have that lived experience and knowledge. A lot of times you could hire an Indigenous person, they may not have that, and they're not going to be able to bring those things that really need to. We've been assimilated. I've been assimilated, but some of us are a little bit maybe further along, trying to unpack that and change those things. So I think having the right people, it is possible, and there are a lot of, I think there's a lot of good things about the system that we do have too. And so I think it's embracing the things that are good, but then things that are causing harm, that aren't working, and creating space for other things is super important. And for more of the healthcare kind of hospital sector, it's a broken system right now. You just have to turn on TV and listen to the politicians, and this is an old way that is very adaptable, that can use that, but there hasn't been a spread in scale. I would say BC in British Columbia, maybe they've been able to do a lot more because of the First Nation Health Authority, but I would say it's a different landscape here. But I think there is that opportunity, and you're starting to see even in Toronto, there's a lot more Indigenous health teams pop up, a lot more positions. So I think we need to continue on that, and organizing, and so there is a lot of that work happening. It just takes time and commitment.
Thing there, can I just to jump in there? But Paul, like the work that you've done, you've done it within a Catholic-run hospital, and this team has really it's a bit within a colonial structure, really, that you've kind of carved out the space and found a way to engage with the community. So it is possible, albeit it'll take time.
Mm-hmm.
As you said, if the right people are out there to introduce this type of change,
right,
in a current structure.
It's healing.
Yeah.
We have to look at it as a healing lens. Colonialism is almost, you want to look at it as a disease, so we need to heal from that disease. We need to aggressively, sometimes we have to aggressively challenge the disease, right? And so that's what you see, our people protesting for our rights, because like this is having, big impacts. The economics and health are very related. If you look at reserves, the land mass, how can anyone be healthy on these small little parcels of land? We were talking, people were talking about at lunchtime about the cost of living in the north. I think went from Nunavut. How can people actually be healthy with the challenges like this? That access, yeah.
Thanks for that. We actually have a question. Maybe I'll grab the mic, Denitha, and pass it over to one of our council members. Okay.
Thank you so much for your informative talk today, in really just practical terms that you've been able to break down how you've been able to move the work incrementally, because it is iterative. And I think a lot of times we want these like really fast stand-ups of like reconciliation work, but it doesn't operate that way because it didn't happen overnight, right? So it's not going to be fixed that way. And I know about like a particular health space right now that's struggling in terms of their reconciliation work. And as you were speaking, I was thinking of them because the example that you gave where the folks who are leading the work are white, and have like formalized leadership positions. And then there's a few folks who identify as Indigenous in the organization, who are of lower positions that don't have a significant say in the strategy, and are actually feeling like outside of the work that's supposed to actually be representing their community, and so there's some tension there, and there isn't a regard in terms of really bringing it together in a way where we are actually hearing the voices of the people just because of positional power, right? And them not having that. And so I guess I would love your insight for organizations who don't have like formalized positions in place, like yourself, that's actually positioned well as a director or VP in the senior team, and the work is primarily being driven by white uh, staff members, and they are actually taking offense to being like to saying like we should be sharing the space, and this is not like we're reproducing colonial ideas, like that people are taking this really personal. um and so I guess I would like to know if you had any advice for organizations that may not have Indigenous people positioned in the right way in the organizational structure, and how can they still move on the reconciliation work without reproducing these same colonial structures and ways that it has been happening.
Yeah, I would say like leadership matters. The decision makers matter. And I do talks on this work at other places and boards, and to other leadership forums, and I think that's one area I really try to to really create organizational change. It's going to be really slow if you don't have that executive leadership. Like, even for me as a director for many years, like, things are moving along, but I would say there's been a significant shift from going from director to VP, because I have to convince, educate that director, and then they're trying to translate what I'm saying instead of being at the table and actually being able to weigh in on decisions. So I would say boards need to create adequate space, not 1-2 kind of tokenized positions. And I would say in healthcare and other organizations, like, there needs to be these positions created. And we're a small to mid-sized organization. Like, we're 2,500 employees. So I know in Toronto, like, there's some massive organizations. So to commit to that is not easy. Like, I know some of the organizations have committed to a director level, which is a good start, but even that is just, for these massive organizations, I think it's so hard. How do you actually, create the change? Like, our organization is pretty big, but relatively small compared to some of these other ones. So I think, yeah, I don't know how it's the power, right? It's, people don't want to give up power. And that's really the crux of it, right? Like, we just had Prime Minister meeting with the premiers, and First Nation people are left out, right? So what are we doing? We're out protesting here because our rights aren't being included, because we're not at the table. What's the history? What's the lesson of history? Canada was created by the French and the British. What if that we would have followed through on the treaties? How great would our country be today if we were actually included? And including other voices. I think we do that to a certain degree, but the difference is us being the first peoples. An elder used to always say, we're the land lords. Never forget that. And that's what these treaties are. And we're kind of getting through, but that's what health system transformation is. But because we have our own system, but our rights doesn't diminish when we come to mainstream healthcare. Our rights have to be recognized, and so I think that's the way to be able to do that, unless they partner with another Indigenous organization. Yeah.
Thank you so much, Paul. I know we could have discussed a lot more, but we really appreciate you sharing your insights, and we hope that the registrants listening at home found this really helpful, as I did. I think this is important work. It's not quick work. There's no checklist. We have to sort of, as you say, be uncomfortable, be vulnerable, and move into this work with an open mind and an open heart. And we really appreciate your insights on it. So thank you again.